Breast cancer starts when cells in the breast begin to grow out of control. These cells usually form a tumor that can often be seen on an X-ray or felt as a lump. The tumor is malignant if the cells can grow surrounding tissues or spread to distant areas of the body. Breast cancer occurs almost entirely in women, but men can get breast cancer too. Cells in nearly any part of the body can become cancer and can spread to other areas of the body. Breast cancers can start from different parts of the breast. Most breast cancers begin in the ducts that carry milk to the nipple. Some start in the glands that make breast milk. There are also other types of breast cancer that are less common, such as sarcomas and lymphomas, and are not really thought of as breast cancer. Breast cancer can spread when the cancer cells get into the blood or lymph system and are carried to other parts of the body. The lymph system is a network of lymph vessels found throughout the body. The lymph vessels carry the lymph fluid and connect lymph nodes. Lymph nodes are small, bean-shaped collections of immune system cells. Lymph vessels are like small veins, except they carry a clear fluid called lymph away from the breast. Lymph contains tissue fluid and waste products, as well as immune system cells. Breast cancer cells can enter lymph vessels and start to grow in lymph nodes. Most of the lymph vessels of the breast drain into lymph nodes under the arm or around the collarbone. Changes or mutations in DNA can cause normal breast cells to become cancer. Certain DNA changes are passed on from parents, inherited, and can greatly increase the risk of breast cancer. Other lifestyle-related risk factors, such as what you eat and how you exercise, can increase your chance of developing breast cancer. But it's not yet known exactly how some of these risk factors cause normal cells to become cancer. Hormones seem to play a role in many cases of breast cancer, but just how this happens is not fully understood. Breast cancer is the most common cancer in American women, except for skin cancers. According to the American Cancer Society estimates, the current year estimates for breast cancer of 2017 are that about 252,000 new cases of invasive breast cancer will be diagnosed in women. Also, about 63,000 new cases of carcinoma in situ will be diagnosed, and about 40,000 women will die from breast cancer. Pretty sad. In recent years, incidence rates have been the same in white and African American women. Breast cancer is more common in these women compared to women of other races/ethnicities. Breast cancer is the second leading cause of cancer death in women. Death rates from breast cancer dropped from 1989 to 2007. Since 2007, breast cancer death rates have been steady in women younger than 50, but have continued to decrease in older women. Knowing how your breasts normally look and feel is an important part of breast health. Finding breast cancer as early as possible gives you a better chance of successful treatment. But knowing what to look for does not take the place of having regular mammograms and other screening tests. Screening tests can help find breast cancer in its early stages, even before any symptoms appear. The most common symptom of breast cancer is a new lump or mass. A painless hard mass that has irregular edges is more likely to be cancer, but breast cancers can be tender, soft, or rounded. They can be painful as well. For this reason, it is important to have any new breast mass or lump or breast change checked by a healthcare provider experienced in diagnosing breast diseases. There are different tests that can be used to look for and diagnose breast cancer. If your doctor finds an area of concern on a screening test, or if you have symptoms that could mean breast cancer, you will need more tests to know if for sure it's cancer. Devices such as mammograms, breast ultrasound, breast MRI scans, and experimental breast imaging are really helpful when it comes to trying to detect your breast cancer, if any. If you've been diagnosed with breast cancer, you probably have heard a lot of different terms used to describe your cancer. Doctors use information from your breast biopsy to learn a lot from important things about the exact kind of cancer you have. You may also have or need more tests to get more details, such as the stage of the cancer or how fast it is growing. There are several types of breast cancer. The type of breast cancer you have depends on where in the breast it started and other factors. Types of breast cancer include ductal carcinoma in situ, invasive breast cancer, angiosarcoma of the breast, inflammatory breast cancer, and Paget disease of the nipple. There are several ways to treat breast cancer, depending on its type and stage. Some treatments are called local therapies, meaning that they treat the tumor without affecting the rest of the body. Types of local therapy used for breast cancer include surgery and radiation therapy. These treatments are most likely to be useful for earlier stage cancers, although they might also be used in some other situations. Doctors on your cancer treatment team might include a breast surgeon, a radiation oncologist, and a medical oncologist. Many other specialists might be part of your treatment as well, including your physician assistants, nurse practitioners, nurses, psychologists, social workers, nutritionists, and other health professionals. All right, that's it for today. Thank you for watching.